Hello everyone, my name is Marcus Sanders and today I'll present my macro project titled Developing Behavioral Health Resource and Staff Training Toolkit. I'm completing my internship at Canyon Ridge Hospital located in Chino. The agency's mission focuses on providing compassionate, patient-centered care and provides dignity and recovery and successful reintegration into the community. The hospital has several key services such as inpatient psychiatric treatment and provides crisis stabilization and medication management for individuals experiencing acute mental episodes. Outpatient services provide ongoing therapy, psychiatric follow up, and group support to help individuals maintain stability. Um, Discharge planning connects patients with community based resources such as housing, substance use treatment, and social services. The social problem I address is inequitable access to behavioral health resources and fragmented systems of care. This problem occurs when patients leave treatment without clear guidance or access to resources they need to continue recovery. These gaps often result in relapse, disengagement from services, and hospital readmission. This issue primarily affects low income individuals, ethnic minorities, and individuals with severe mental illness. Many patients discharge without knowing where to access care or housing support. In addition, the workforce shortages that we face and inconsistent resource information make it very difficult for staff to provide accurate referrals. From a social justice perspective, this problem reflects systemic inequities in healthcare. My approach to this project, as far as the Christian faith integration, is with the professional social values in mind. So, for Christians, the teachings emphasize compassion, justice, and service to those who are vulnerable. And those values align with social work principles such as dignity, worth of a person, and social justice. In this context, faith calls us to actively support individuals who are marginalized and to reduce barriers that prevent access to care. Um, for the proposed activity, my macro project is based on developing a behavioral health resource and staff training toolkit. This project includes creating a structured resource bank that provides updated and accessible information about community services. It also includes developing a training curriculum that teaches staff how to effectively use these resources and discharge and in discharging their planning. Key stakeholders include social workers, nurses, psych- psychiatrists, hospital administrators, patients, and community partners. Each group plays a role in either delivering care or benefiting from the improved coordination. My role involves designing the toolkit, organizing information, facilitating staff training, and gathering feedback from stakeholders. The project follows a clear timeline. I conduct a needs assessment, I develop the resource toolkit, and then I implement the training sessions. Finally, I'll evaluate the effectiveness of the intervention. This structured approach ensures that the project is both practical and also sustainable. For the needs assessment, I identified the need for this project through direct observation and engagement within the agency. During my internship, I observed inconsistencies in how accessed and shared community resources. Many staff members relied on outdated information or personal knowledge rather than standardized tools. I also reviewed referral practices and noticed gaps in discharge planning where patients often left without a clear or a follow-up support. To gather data, I used informal interviews with some of the staff. observations during discharge planning, and review of the agency processes. Stakeholders, especially social workers, expressed frustration with the lack of centralized resources or the resource system. They also identified the need for training to improve confidence and resource coordination. Key findings showed that the lack of standardized tools and updated information directly impacts continuity of care. This confirmed the need for a structured and accessible solution. For anticipated outcomes, I expect this project to produce measurable improvements in both staff performance and patient outcomes. First, I expect the report to report increased confidence in locating and using community resources. The goal is that at least 80% of staff feel more prepared after the training. I expect improvements in discharge planning. Staff will use standardized tools and provide a clearer and more consistent referrals. Patients will benefit from the better continuity of care. They will leave the hospital with a clearer guidance and access to services. In the long term, the project may contribute to reduced hospital readmissions and improved recovery outcomes. The stakeholders support these outcomes because they align with the agency's mission to provide effective and equitable care. For updates and evaluation, at this stage I have completed the needs assessment and began developing the resource toolkit. I am currently organizing both digital and physical materials and gathering stakeholder feedback to ensure accuracy and usability. To evaluate the project, I'll use multiple methods, including staff surveys, key informant interviews, and training evaluations. One of the things I could ask is, how confident are you in locating community resources? Or did this training improve your discharge planning skills? These evaluation tools will help measure both the knowledge improvement as well as the practical application. I'll also include a visual example of the toolkit or training materials to demonstrate the progress. This evaluation process ensures that the project remains effective, adaptable, and sustainable. For this project, it's supported by scholarly and professional sources related to behavioral health access, workforce challenges, and healthcare social work practice. These sources provide evidence for the need to improve resource coordination and staff training within the healthcare systems. They also support the importance of addressing systemic barriers that impact vulnerable populations. Thank you for your time, and I appreciate your attention and welcome any questions.